Here at 5, another developing story we're following closely. A U of L Health birth center at Marion Elizabeth Hospital, that's down on the south end near Iroquois Park, is now delayed indefinitely after plans to open it this fall, blaming impending Medicaid cuts passed by President Donald Trump and congressional Republicans.
In a statement, U of L Health said, quote, 44% of Kentucky births are financed by Medicaid. That funding was instrumental in developing our plans for the birthing place at U of L Health Marion Elizabeth Hospital. The expected loss of Medicaid funding jeopardizes the viability of bringing labor and delivery services to South Louisville.
So we pick up on this tonight with WHS 11's Ian Hardwitt reporting on the fallout. And he has got more on why that center is historically significant for that part of Louisville.
Inside Granny's Birth Initiative on 16th Street in West Louisville, the nonprofit helps mothers through all stages of pregnancy.
People are able to have their children here as they see our clinical services.
Director Alexa Cisney had planned on partnering with U of L Health. Granny's prepared to hire out doulas who coach people through pregnancy to a now delayed birthing center at Marion Elizabeth Hospital that would have opened this fall.
Even as a home birth midwife, I'm saddened because people look for those options. Home birth is not accessible to them, or they're not low risk, and they were really looking forward to that midwifery-led model of care in the hospital environment.
Had it opened, it would have been the first place to deliver a child west of I-65 in Louisville in over 50 years. U of L Health blamed Medicaid cuts passed in the big congressional budget bill this year. Those cuts raise requirements for Medicaid and also make paid insurance through the Affordable Care Act more expensive.
Now we realize there are going to be some cuts from the feds and what they're coming through, but we're trying to really minimize that.
State Representative Ken Fleming co-chairs Kentucky's Medicaid Advisory Board, which will look at how Kentucky's $20 billion Medicaid dollars are spent, most of which are reimbursed by the federal government.
And make sure there's no fraud and abuse. We're still in the beginning stages. We don't know if it's out there, but we are getting a lot of information, and we're going through and dissecting that to see.
Fleming says that's to make sure the people who need Medicaid most can still access it. But Cisney said the cuts already cost Medicaid recipients opportunities.
There were expecting families that thought that they were going to be having their children at this center.
But she is offering help: diapers, on-demand doulas, and baby clothes, plus medical services funded through Louisville Metro's Healthy Start grant.
And now we're just looking to let people know that we're here to fill the gaps at Granny's Birth Initiative.
Gaps she can fill because the money's all local. In Louisville, Ian Hardwitt, WHAS 11 on your side.
U of L Health plans on opening a women's health center where that birthing center would have been placed.
The situation is exactly what hospitals and lawmakers have been sounding the alarm about on the federal level. A group of lawmakers created a list of hospitals at risk of closing if their Medicaid revenue is cut, including 35 here in Kentucky. Most of those are in rural areas where finding health care is harder.
Now, a March of Dimes report says 45% of Kentucky counties are maternal care deserts. And a bill allowing freestanding birthing centers just passed in the Kentucky legislature this year. Birthing centers had to be connected to already existing hospitals before 2025, making it nearly impossible for them to stand alone as birthing centers in rural counties as well.